The diversion of drugs from medical facilities. There have been several big stories in recent years. These are some of the headlines about techs sentenced to decades in prison, patients infected with the liver-raging virus Hep C, and the irresponsibility of some medical facilities. Some people are trying to change this.
I was just feeling the stress and the weight of everything. And in the environment I worked in, it was just a difficult setting. It was hospice and palliative care, so I think it was just a lot for me to process, and I didn't know how to deal with my emotions.
Amy Kuntz diverted narcotic opioids for 7 years at different jobs before she got arrested and got help.
I could only go about, I would say, maybe 6 hours without a dose of pain medication in my system before I would become violently ill. And violently ill, like I wasn't even able to get out of bed. There's ways around systems, but mentally and inside myself, I was exhausted and not well.
And you were thoroughly addicted.
Thoroughly addicted.
Amy says the ways around the systems were easy.
If a doctor had ordered 2, say, Norcos for a patient, I would give them one and I would pocket one for myself. If a family brought in medications from home, we're supposed to send them down to the pharmacy to get counted and checked, and then they send them back up to the floor. I would not do that. I would dip into them and then send them down so the count wouldn't be off.
Amy wanted to be a nurse like her mother since she was a little girl, but she didn't think about her mother, her son, career, or reputation as much as she thought about feeding her addiction.
I was completely miserable. It was a very dark place.
Amy was a good nurse, a really good nurse. That can be a red flag for diversion.
I picked up extra, I stayed late, I helped other nurses, but I will say to you that some of that was because I was needing to feed my addiction.
We found out very quickly that about this problem, and about that it was really a little secret and not much was being done about it.
Berkey found out about how big this little problem is when he was a Cincinnati police officer. The department got a grant for a drug diversion team in 1990.
For about 9 years, we arrested a healthcare professional that was diverting drugs inside of the healthcare facilities about 1 a week. So we would make about 50 arrests a year.
50 arrests a year for a population of 400,000 in Cincinnati. The diversion unit used the stats to calculate for the country.
About 102 a day is how many arrests should be going on, 37,000 some odd a year.
The reason that's not happening is disturbing. Many medical facilities don't want to deal with diversion.
I think it's more of turning a blind eye, frankly, letting the person resign, firing them, whatever, get them out of here, get them off our premises, and let's move on. And unfortunately, that's more the mindset than doing something about it.
That's what happened to Amy. When the first facility where she worked got suspicious, she was called to the boss's office.
All I had to tell them was that I'd like to resign, and they were perfectly happy with that. I had 4 jobs after that in total, because there was no stop measure in place of, look, she got in trouble at this hospital, let's stop this, there's nothing like that right now, unless it's reported.
Because of the failure to report, Amy kept getting jobs, stayed addicted, and treated patients while high. The most alarming failure to report involves traveling radiology tech David Kwiatkowski, who is serving a 39-year sentence for causing a multi-state outbreak of Hep C. He infected scores of people with his virus when he stole syringes full of narcotics that were then used on patients. He was fired from one facility after he was found passed out in the men's room with a syringe floating in the toilet. The facility did not file a report. Kwiatkowski had another job in 2 days. He worked at 19 hospitals in 8 states before the Center for Disease Control linked him to the national health crisis.
It's the poster boy of this problem, and I was always hoping that maybe his experience and the hospital's experience with this guy would maybe have changed them. I'm not so confident that it has.
But in Colorado, for example, there are new laws that require criminal background checks and drug tests on surgical technicians, in part because of surgical tech Kristen Parker, who infected 19 patients with hepatitis C at Rose Medical Center in Denver.
I remember sitting in the ER next to the doctor, and on his lap he had some papers, and on the papers it said hepatitis. It was horribly scary. I mean, really, when you think about the idea of hepatitis, you're hoping like, oh, maybe hepatitis C or A, hepatitis A, that foodborne. Maybe I just ate something. You don't think that you have an infectious disease.
That was 6 weeks after the mother of a 1-year-old had outpatient surgery at the hospital for a kidney stone.
I did call the state health department back several times and just saying, please do whatever you can. Please do your investigations. Do whatever you can to figure this out. And unbeknownst to me, I was one of 2 people who had surgery a day apart at that facility. And we both came back with the acute version or symptomatic version of hepatitis C.
Kristen Parker was arrested 4 months after Lauren's surgery for doing the same thing Kwiatkowski did. She stole syringes from operating room carts, then replaced the fentanyl with saline. Parker said she figured out how to divert her second day on the job, and she knew she had hepatitis C.
The syringe of fentanyl that I was supposed to have for my surgery actually was a syringe that she had used, filled with saline and her hepatitis C virus.
Like most diversion stories, Parker worked at other facilities and was let go with no paper trail. Like other diversion stories, there were red flags, starting with a letter from a coworker who said Parker was found in operating rooms when she wasn't scheduled.
A week later, she was walking down the hallway and she was passing another employee, and she stuck that employee with a syringe. At that point, they put her on a 1-week leave while they did some drug testing and did some investigating. And when they did the drugs panel, they didn't include fentanyl. So fentanyl was what she was diverting, and that was one of the top diverted drugs at the time, and that wasn't on the drug screen. So a week later, she was back at work.
Rose Medical was named in numerous lawsuits that said the hospital engaged in extreme, intentional, and reckless conduct. When the then 27-year-old Parker was sentenced to 30 years in prison, she said, "I am not the monster drugs made me out to be."
The longest term effect I have is my survivor's guilt. Because of the 19 people, I was one of the lucky ones who was able to clear the virus on my own. And there was a lot of us who weren't as lucky.
Lauren is now a psychotherapist who works with addicts.
There does need to be a safe place for healthcare workers to land who have addiction issues. If 10% of society have issues, at least 10% of healthcare workers have them. So they're out there, and their access to medication and to drugs is so easy. It's just too easy for them, to get it. And we need better supports for them. We need it to be less punitive and maybe more not only preventative, but just give them the rehab they need so that they can move on with their lives as well.
Amy thinks talking about job stress and the darkness of diversion needs to start in nursing school.
Let's sit down with our nursing students and say, look, this is what your schedule is going to be like. This is what you're going to encounter. You're going to have people die, and then you're going to be expected to eat your lunch and go back to work. How are you going to deal with that? How are you going to cope with the fast pace, the crazy schedule? And then when you go home, you have a family to take care of. Let's teach you some ways that are healthy to deal with these problems so that they don't become bigger issues.
Amy got arrested at a pharmacy after calling in a prescription for a home health care patient. Charged with felony identity theft, she went to jail, went to rehab. Now she's a certified drug and alcohol counselor.
When I look at it, I feel like I was allowed to go on to these places because they didn't want to deal with me, but let's be honest, this is happening everywhere. And so after I left that facility, it's still continuing to go on because it's not being addressed. So at some point, the buck's going to stop and they're going to have to deal with it, only it's going to be on a bigger scale. Someone is injured, someone is killed. I could have killed someone.
When it comes to reporting drug diversion, theft of drugs is a crime, a felony in most states, and a federal crime too. When medical facilities fail to report loss or theft of drugs, it not only encourages more thefts, but can lead to civil and criminal liability.
These are nurses that were making life and death decisions. And if they're impaired, how many people do we lose a year because of that? I don't know. Nobody knows, really.
Berkey says medical facilities serious about doing something about diversion have drug diversion teams that investigate each reported incident to find the best outcome for employee and patient. Berkey says the bottom line is simple.
It's the right thing to do. Exactly. You want to go home at night and lay down your head and know that you've done the right thing.